and welcome. You have made it to our webinar on chiropractic care and ear infections. I am Dr. Katie Elmore. I'm the owner at Elmore Family Chiropractic in Caston, Minnesota, and I focus primarily on pediatrics and prenatal care within chiropractic. And I have two young ladies of my own, so I know what it's like to kind of go through the battles of having young children. So today we're going to cover what it looks like when a kiddo has an ear infection, what happens in the first place, and how chiropractic can help. So first off, I know how hard it can be when we see our kids struggle. And it's not, just a one kid issue. It affects the whole family because not only are we going to continuous pediatric appointments because we have to get them checked out, but we're missing work. We're having to schedule daycare situations. We have to be away from the other kids. We are sometimes then looking at multiple antibiotic use and just what that can do to their tummies. We can risk hearing delays, or hearing loss and speech delays, and then just caring for a little one that is not sleeping well. So they're not sleeping, you're not sleeping, and that makes tensions rise a little bit in the household. And it just doesn't feel good to see your kid not feeling well. So what we want to look at is how chiropractic looks at ear infection more as a drainage problem than a bacteria problem. And so it's interesting, right, that 80% of children will get an ear infection and they will have it by the time they are 3 years old. And in the US, more than, 30 million visits to the pediatrician for this reason. And some kids are not just getting one, they're getting 6, 7, 8, 9 ear infections, and then they use antibiotics. Why aren't they working? They use tubes. Why aren't they working? Why does not every kid get one? That's an interesting thought. So why is it that some are getting it and some are not? And we often look at this as it's a normal thing. And I want to preface it by saying it's probably common, but I'm definitely not going to call it normal. I have two young ladies and we never had an ear infection. So why is that? All right, so we're going to cover a little bit of what normal anatomy looks like in an ear. Normally, I have a whiteboard. Couldn't find it. So you get the more sophisticated ear diagram that I printed off. Okay, so essentially, we have external ear, we have the external ear canal, we have eardrum, and then we have the inner ear, and then eustachian tube. So what we want to look at is, okay, so we have this tube out here, we have the eardrum, and then we have fluid that sits in the inner ear. And normal function of this fluid is to stay within the inner ear and then be pumped out through the eustachian tube. So why I say ear infections are usually a drainage issue is because this fluid is naturally supposed to leave the ear canal and go through the eustachian tube. So what often happens in these ear infections in young kids is that for some reason this fluid is not being pumped out. So if this fluid sits in this canal for too long, it starts building up bacteria, and that's when you get the bulging of the eardrum, the redness, and the infection. And so what we look at doing as chiropractors is fixing this drainage issue so that we can get the fluid out of this area and go down the eustachian tube. Why is this more common in kids? Is because their eustachian tube is shorter and it's more horizontal. And so you can see here that we have a nice slope that will drain down, but in kids, their ears are more horizontal and it doesn't have that steep of grade, so that there's less drainage. So when there's less drainage, then there is more fluid trapped in here. And then when you get that fluid trapped in here, there's a lot more pressure, infection, and that's where that pain can come from for the kiddos too. Also, a lot of times, if we can catch it before it becomes a bacteria issue, then we don't have to treat it with antibiotics. And so do we have to do that sometimes? Absolutely. For our house, it was always a rule of thumb of A lot of times if there's bacteria, we'll get a high grade fever. And so if we have a kid that has ear pressure, is uncomfortable, but no fever, then we treat it as, okay, this is a drainage issue. This might be a viral issue. What can we do to move forward from that? Okay, so what can cause this pumping action to not work as it should? And so first off, it can just be from a more strenuous labor. I don't love using the word traumatic for labor, right? But some are more stressful than others. Some have to use forceps or vacuum or those types of things, and that can just put a lot of pressure on those baby heads. Life stresses. We don't often think as a 1-year-old having a life stress, but falls or illnesses or anything that can cause a disruption of those moving parts and having the spine not work correctly or as it should can be a sign of physical stress in the upper neck. So going to that, the most common subluxation when we're looking at an ear infection is the C1. So C1 is the very top cervical vertebrae that sits right here. And you can see how close it is to our ear. So basically, what we'll often look at is if that C1 goes left or right. And so say we're having a painful right ear, we find that C1 has transversed or moved over to the right a little bit. That can cause inflammation in that area, and that can be the thing that is causing that drainage not to come down, because when things are filling that area, inflammation, irritation, then we can't get it down eustachian tube. And so as a chiropractor, we gently move that guy back into place and allow for that ear to start draining so that we don't have that buildup of fluid anymore. Complicating factors. So what outside of those normal physical stresses can we be looking at? So intense labor and delivery. We can also notice nursing issues. And sometimes, right, so if we're going back to this side and this guy is pushed to the right, oftentimes these kids don't want to tip into it, or they're kind of stuck into this position. And so that can bring some tightness and some tension into the upper neck. Torticollis is the same thing. They get stuck in lateral flexion and rotation. And so this area also gets stuck into that position. And so we can do an adjustment, do some stretching, get that, but that can make ear infections worse too. And then sometimes teething, right? So we have inflammation coming from the jaw, which is again right here. That inflammation can kind of settle in this area, and that can prevent drainage. So what we do as chiropractors is we are going to allow for that proper drainage. We're going to help boost the immune system by activating the parasympathetics. Haven't really talked about that yet, have I? So basically what it looks like is there are certain areas of our spine that will activate our parasympathetic nervous system, and that is our rest, relax nervous system. And so if we adjust those, the body just works more efficiently, is able to adapt better. And so if we can activate our cool, calm, relaxation mode, then our body just works better, less irritation, less drainage issues. So we just want to check kids on a regular basis and make sure that we're not seeing issues before they become bigger issues, and then treat and then help induce that pumping action within the eustachian tube. So to be clear, we do not treat ear infections. We treat the drainage issue that is often causing the ear infections. All right. What does a chiropractic adjustment look like on a child? I was going to bring one of my daughter's babies, but she was real creepy looking, so I figured I can just describe it for you. So kid adjustments are very gentle. There is no popping, cracking, twisting, or anything like that. And it is often light fingertip pressure. So what I call it is sustained pressure. So essentially, I hold the position with my finger that the vertebrae needs to move in. So if, say, we're noticing right rotation, lateral flexion, basically I'm going to hold it and just kind of gently nudge it in that direction. And I just maybe do a little jiggle to it, but we just hold it until that baby relaxes, the muscles relax, and the joint just kind of slides into place. we're focusing on correction of the upper neck and making sure that they're all balanced. And then we also look at cranial balance. Cranial sacral work looks about the same, but even less movement. So when I'm adjusting baby's neck, I might slightly turn them or stretch them, but nothing more than that kind of movement, normal natural movement that they can do. Cranial work is often just pressure on the cranium. So you're just holding pressure, waiting for one side to kind of open up or go move slightly up or down. These are very small changes, and so you won't see them with your eye. Trained professionals are able to feel when they are moving in a better position. Having your kids adjusted is incredibly safe. There's a lot of research that backs that. So this should not be a scary thing. We collaborate with pediatricians. We still know that it is important that not all ear infections can be solved this way, that antibiotics do have to be used in some situations. And so I want you to feel like this is an open place that you can come and see if this is something that fits for your child, if you've tried all the other things, right? We do have videos on our Facebook or our YouTube page that will show you what it looks like to adjust. I think he's a couple month old, and we try to show what it looks like at different ages. So you can look for those on our sites. So what you want to look at home, if you're noticing your child doing something different, and you're thinking maybe this is an ear infection, so you want to look for signs of drainage issues. So that can be the head tilt, that can be constant congestion in the nose, and the sinuses. It can be mouth breathing because they just are, again, congested through the nose. They can have recurrent ear infections. And so sometimes it's just the same ear infection that is not being completely cleared each time. And we also will sometimes notice delayed speech. And a lot of that is just because the hearing gets affected. And so when their hearing is affected, they can't speak or learn those sounds correctly because they're not hearing them. So what can we do at home to support them at home? So we want to do more upright feeding. So that, again, there's that less pressure from the coming eustachian tube. We want to do more tummy time. We want to reduce prolonged car seat sitting. I know that can't always be the case, but try to prevent it as much as possible. And then encouraging head turning both directions. And so sometimes what this looks like, so if we have a child that is nursing, we want to make sure that we're nursing on both sides so that they can turn and tip their head both directions. If they can't, that's a sign that something is off in their upper neck. Same thing. If we're bottle feeding, I get from a lot of parents that they always bottle feed on one side. It's not as much turning and tipping for the head, but they do need to get used to having it done on both sides so that they can help induce that rotation of the upper neck. And then what do we do next? How can we seek help if we're having issues? I want to be a stop for people that are looking for another solution and maybe what they're doing isn't working right now. But I do want to be responsible in saying that, pediatric care is necessary if we're seeing a high fever, if they're lethargic, if they're in pain, if the eardrum ruptures. So these are things that we have to be responsible for. Okay. And if your kid keeps getting ear infections, let's look at function. Let's look at drainage. Let's look at what we might be able to do. So that is my little spiel. I hope it was helpful for you. If there are any questions, you can absolutely write them down in the comments, or you can direct message us at our Facebook page. And we do have resources within the office as well. So if you're looking for more information, give us a call, or email or Facebook or all the things that we can do now. All right. So if you're a tired parent, done wasting your time with ear infections, wait no further and give us a call. Thank you.